Good afternoon, everyone, and thank you for joining us. Welcome to the virtual community meeting to talk about the development of a new national health strategy for the Cayman Islands. My name is Lauren Stainton. I'm a Senior Policy Advisor with the Ministry of Health and Wellness, and I'm also the moderator for today's session. So we're here to discuss the development of a new national health strategy for the country. Throughout the month of May, we have been doing a range of different consultation exercises. This will be our third community meeting. We have one more. This is our first virtual community meeting. So thank you for everyone joining us on CIGTV, YouTube and Facebook Live. I would like to say that the purpose of today's session is to gain your feedback. So if you have any comments or if you have any questions, we'd love to hear from you. Please contact us via WhatsApp, which is 936 4969, and we will get your comments and your questions. So I'd like to introduce the panel. So this afternoon we have the Chief Officer for the Ministry of Health and Wellness, Ms. Nellie Pucci. We have our Chief Medical Officer, Dr. Nick Gent, and our Chief Nursing Officer, Felicia McLean. Thank you. Okay, so just very briefly, so our new national health strategy, so we are looking to develop one for the country. It will be the overarching document that sets the strategic direction for the health and wellbeing in the Cayman Islands over the course of the next decade. We have engaged with a range of different individuals, key organisations, both government and non-government, and of course members of the public. So your participation today is extremely valuable. So we would encourage everyone to send a comment or send a question, and the panel will gladly answer or feedback on that. With the National Health Strategy, we will have a public health focus, and that is looking at preventing disease, prolonging life and promoting health. And so we are not coming to the National Health Strategy development with any sort of predetermined ideas about what should be in it. We're really open to hearing from members of the public and a range of different stakeholders. So please comment and send your questions in. This forms part of a broader consultation right throughout the month of May, ending on the 31st of May. So we would encourage everyone to please feedback. So within the ministry, we look at health and wellness. And so when we think about wellness, we don't just think about sort of that physical wellness. It's obviously also looking at emotional wellness, mental health components, environmental wellness, social wellness, spiritual wellness, intellectual wellness, and occupational wellness. So when you're texting in, please don't be limited to thinking about sort of physical or mental health. We are thinking about health and wellness in the broadest sense. We're also touching on the social determinants of health, so things like housing or infrastructure. So please feel free to text in and send your comments and questions. So the layout for the session today is we will show you a brief video, and it explains what we are trying to achieve in the development of a national health strategy. I'll turn to the panel and we'll have a brief discussion, and then we will move into getting your questions and comments. So we would like to just show you a brief video.
Let's talk health, Cayman. The Ministry of Health and Wellness will be undertaking a public consultation for the development of a new national health strategy for the Cayman Islands from May 1st to May 31st, 2024. We need your input, but first we want to tell you a little bit more about the process and what we are trying to achieve. The National Health Strategy is an agreed-upon blueprint that helps to determine the health priorities for the country over the next 10 years. Individual citizens, public and private healthcare providers, patients, advocates, insurers, NGOs, faith-based organizations, and other relevant government ministries, departments, and statutory authorities will all have the opportunity to contribute to the strategy, as our aim is to ensure that the nation's needs are accurately reflected in the document. The last National Health Strategy for the Cayman Islands was created in 2012 and it was a 5-year strategy from 2012 to 2017. The needs of our population have changed significantly since then, and that was even before the 2020 COVID pandemic impacted the world. Based on those changes, our ministries focused on data-driven decision-making, as well as the lessons learned from COVID-19. We feel that this is the right time to tackle this significant and overdue project. The National Health Strategy is looking to include all aspects of health, with a specific focus on public health. Public health is the science and art of preventing disease, prolonging life, and promoting health through the organized efforts of society. Environmental health, mental health, sexual and reproductive health, and overall physical health are all public health. Cayman's new National Health Strategy aims to protect and promote the nation's public health outcomes, and to do so, we must embrace the notion of health as broadly as possible. The public consultation for the National Health Strategy is open to all Caymanians and residents of the Cayman Islands. Persons of all ages, especially children, teens, and young people, are encouraged to participate. Persons with special healthcare needs, chronic illnesses, or those who have or are experiencing difficulties accessing healthcare services are also urged to share their thoughts. Health impacts everyone, so it is everyone's business. Ready to have your voice heard and help shape healthcare in Cayman? Great, here's how. There are many ways to engage with the Ministry of Health and Wellness during the public consultation period. You can fill out our very short survey, less than 10 questions, and give us your feedback. Send us an email on mohfeedback@gov.ky telling us your thoughts and experiences with Cayman's healthcare system. Engage with us on radio and social media during the month of May, or even come out to a virtual or face-to-face town hall. Feel free to engage as often as you'd like as we welcome your feedback. The public consultation period will run officially from May 1st to May 31st, 2024. However, the public survey is already available on our website, www.gov.ky/health-wellness, and you are welcome to send in comments to mohfeedback@gov.ky if you have them. Thanks for engaging, and please tell your friends, family, and coworkers about it so that they too can be heard.
Okay, so we would just encourage everyone to please send your comments and questions into us. Just to reiterate that the public consultation is from the 1st to the 31st of May, so you have a little bit of time left to fill out the public survey, which is available on our website, which is www.gov.ky/health-wellness. But today we're here to discuss the development of a new national health strategy with our panellists and to answer your questions and respond to your comments that come in. So I just wanted to turn to the panel to ask a few questions just to kick us off. So, panel, why do you think a national health strategy will be so important for the Cayman Islands?
Thank you, Lauren, and thanks everyone again for tuning in with us this afternoon. We're extremely grateful. Today we wanted to just go through what we're doing with the National Health Strategy and what those aims are. In terms of that, we do see that as that guiding document for our islands that will speak to us in various aspects of healthcare, and getting the feedback from our public is so critical, so important, and we're all users in the healthcare system, and our voices as citizens, as practitioners, as persons living on the island is very important as to how we see healthcare currently and how we want to see that in the future. So that's critical for us, and in terms of dealing with healthcare, from a financing, from a workforce planning, from resourcing, all the various aspects of it is going to be absolutely critical on how we move forward in terms of healthcare.
Yeah, I think to add to that, for timing-wise, I think we've got to bear in mind that the nature of diseases, whether they're physical, mental, emotional, whatever, have changed very considerably. I've been practicing medicine a little too longer than I'd like. I've been practicing for about 40 years, and the nature of illnesses, remembering back to my childhood and when I was first a medical student, very, very different to how they are now. And we've got to keep up with the changes in patterns of illness. 50 years ago, Infectious diseases were very dominant. They're relatively rare, fortunately now, with the exceptions of things like COVID, and that really caught us by surprise. Heart disease is less common, or certainly more amenable to treatment. We're getting older, so it's far more likely that the numbers of cancers will be rising in society, and we've got to keep ahead of that, and we've got to make sure that we're able to respond. And of course, our ability to respond depends upon us planning what interventions that we can provide locally, and whether or not, how they're provided, especially within what is an extremely complex system. We look at somewhere like the Cayman Islands, and we sit here, beautiful, incredible place to be, but it's a population of 80,000 people. That's very, very small in planning terms, so getting it actually right, what we can do locally, what we do elsewhere. We've got a lot of healthcare providers, public and private, and we have the insurance system behind all of that. And so the complexity of how all that comes together is something that we need to understand. And so this strategy is not just about what is the patterns of ill health, and therefore what treatments we provide, but it's also working with the insurers, the private providers, but taking the patient's stories behind it of how could they afford their care, where did they get their care, what they wanted to see that would make that better for themselves, their children and their family. So there's all that complexity that's there. And I think the final thing I'd say is that we're broadening our definition of health, and that's really important. Whereas at one time health was, I'm ill, I need to go to hospital, or I'm ill and I need to go and see my doctor. Now it's very much about the preventive services, the wellness services. It's about making our life much better to live, longer, many more years, happier years, physically better years, mentally better years, and so on. And so that public health rather than just a health strategy. I think that's why we need something new and different from 10 years ago or 50 years ago.
Yeah, so I guess if I could add, growing up here in the Cayman Islands, and also growing up in the health profession here, starting as a young Caymanian nurse on the ground, I have seen our island developed very fast. And what I always tell this story when I think of it, because I still consider myself rather young. I remember still pulling water out of a cistern because that was the environment that we lived in, and we've grown so fast, and unfortunately we've grown so fast that we've grown before our laws. And so this particular document will help to guide our lawmakers in regards to what we need to have in place to really reach that goal of meeting the need for our total health and wellness of the island, to improve care, first of all, within their own communities, and then to look at, like CO was saying, the environment, our workforce, are we able to walk and exercise? Are we able to access good health care? Are we able to ensure that our kids get the right care so that they don't fall trapped to the same diseases that we see have happened, so that life in general and overall will have an overall wellness. And we're also looking at that mental health component in regards to that, because that's another thing that we find that stress and anxiety and just mental health in general, if we don't have a good mental health, we're going to affect our lives in health as well as wellness. And so really excited to be a part of this at this point in time, and super excited that we get to engage the community, because as Dr. Jet mentioned, it's no good if I say, well, this is what we do in Barbados, or this is what they do in the US, or this is what they do in the UK, but what do we have happening here? Because it's a unique population and we want to meet that need, and we can't do that without hearing from the people, hearing what their challenges are, what suggestions they may have to make things better, so that when we do draft this policy that's going to guide us for the next 10 years, it is really people-driven and patient-centered to make that big difference.
Yeah, and I think the issue that we want to tackle is so broad, isn't it?
Yes.
We do want to have that public health focus, and we are redefining health and what that means for the ministry and for the country. And I think we hope that people aren't sort of lost in how complex it all is. And I think perhaps this very kind of simple question is, what impact is this going to have on just the average person, and why should people participate in this exercise? Why should people message us in and share their comments? What is the impact that it's going to have on individuals?
Yeah.
I think there's a number of very good reasons for that. Firstly, it's ownership.
Yeah.
This is our healthcare service, not our healthcare service in terms of it's the ministries, but ours as the people who live here and love the place and care for our friends and relatives. We've got to all have the same things. It's a democratic process. The days where medicine was autocratic, especially doctors like me, I suppose, who would say, this is what you need and this is for the best, and we tell the lawmakers, you've got to provide this and do this because that will enable us to do that. That's long gone. Okay, we may have expertise, and when I say we, this should be every member of clinical staff. Doctors, dentists, pharmacists, nurses, the care assistants, the physiotherapists. I'm sorry if I've missed you out the list somewhere. But we've got to make sure that it is a comprehensive service, listened to from us listening to everybody, provides it, receives it, may worry about what they'll need and whether they'll get it, comes and speaks to us and tells us, that what it is they want to see in 5-10 years' time.
Another thing is each person's experience is individual, and so that's why we need each person to give it, because my experience with healthcare might be different from CEO's experience with healthcare, and we might all, if we don't share what we experience in those situations, if we don't take the time to complete the survey and add our voice to it, then something very important could be missed. And so we really are encouraging people to join in and participate, because we want to hear from each person, because each person is unique and each person has something to add.
Yeah, and I think even in terms of preventative care, so if we want to go down, exploring that in terms of what works best for our community, and also so if we're not even experiencing ill health, what does good health look like, and how do we promote that, and how do we encourage that? And also, what are those barriers to person accessing good health and being able to live a healthy life? So that's where the average person comes in, and that's where all of us play a part in terms of how we develop the strategy then to make all of our lives better. 'Cause it's very, very important that we hear from a wide cross-section of our community.
And on that note, I want to just add, we were very blessed to have our minister as well as two of our policy advisors attend the UCCI college recently, and they spoke about the challenges that they have accessing care as young adults. But even in that, in the next 10 years, they're going to grow up and they're going to have their own families. They're going to have kids. They may be taking care of their loved one who's older at that point in time and need care. It's going to affect us at every stage of our lives, and so that's why it's so important that everyone speaks up.
Yeah, I think you're touching on a really important point here. Is there are a lot of people in the Cayman Islands who are expert at representing themselves. They will find their way through the systems, and healthcare systems can be complex. And they will make sure that the family gets the care that they need. But there are a lot of people who I meet and speak to in the Cayman Islands who are having a problem with the basics, like, can I afford the healthcare? Can I afford the insurance to get the healthcare? Even if I've got the insurance, does it pay for the healthcare that I need? If I can afford it, who am I going to go and see that's going to deliver the continuity of care that my conditions might need? And I'm really, really keen to hear from people who are saying, I cannot get care, or I don't know who to turn to for the care, because those are the people who are going to tell us where the holes in the system are. The three of us, we've been around the healthcare systems here or other places for a long, long time. We're used to finding our way, but I'd really like to hear from the people who've been lost.
Yes.
And actually, it's really important that we gain the views of a range of different individuals and community groups and others. And actually, I know the Chief Nursing Officer has just come from a meeting with a group of elders in the community, and perhaps we'll get to that in a little bit later. So we just want to put a graphic up for you now just to show you the key question. So what are some of the main issues relating to health and wellness in the Cayman Islands? So we would love to get your feedback. Please message in any questions or comments that you might have related to this question. Okay, so we actually have one question that's come through. I'll just read it out for the panel. So people feel like the healthcare providers are taking advantage of them. What measures can be taken to change this perception?
Okay, complex one. It partly comes back to what I was saying before. Do people feel empowered in the system? Because it's very easy to go and see somebody who speaks down to them, tells them what they need, and people can leave feeling they've not been listened to. And in particular, that can be a problem if they've only got part of the story of the illness out of the way. It's one of those things we teach clinicians these days, is that very rarely does a patient tell you what the main problem is as the first thing. Mm-hmm. Usually they will bring them, some people do. Some people have that confidence, but very often people come into that clinical space and they want to feel their way in. And you'll say as a doctor to them, "How are you?" "Oh, I'm not too bad." Well, that's wrong, because that's why they're here. Yeah. And you've got to encourage them to open that story out. So if we're not inclusive, people won't feel they're being looked after. The next bit, though, and some of my clinical colleagues may feel that I'm being hard on them, is that we live in a world now where there are a lot of investigational techniques available to us. There are a lot of medicines and a lot of newer medicines that are available to us. And the temptation can be to add investigations that add cost and to use medicines which are relatively expensive. And we're not taking account of the circumstances of the individual, or whether indeed those investigations were needed. And probably many colleagues have not been brought up with an environment of thinking, what is the most clinically effective way of managing the care, but I don't need to go beyond that. An example that we've talked about frequently, for example, and I know I'm going to bore people who've heard me about this one before, it's about diabetes, or as we lovingly call it in the Cayman Islands, a touch of sugar. You've even got the hand action off, haven't you? Yeah, we've been talking about this one too often. But we know from the STEP survey, really good piece of work from our colleagues in the ministry, that have uncovered an awful lot about non-communicable diseases. And we know that for diabetes, a third of people with diabetes in the Cayman Islands don't know they've got diabetes. A third of people who know they've got, of people with diabetes, know they've got diabetes and are not being treated for it. And a third of people, the other third of the people with diabetes, many of them are getting suboptimal care and suboptimal treatment. Now, this isn't, as they say, rocket science. We know the optimal management of diabetes, and it can be relatively cheap. You can base, lots of healthcare professionals can be the focus. I'm used to working in a healthcare system where the management of diabetes on a day-to-day basis was done by specialist trained nurses. And they did all the surveillance about people's eyesight, their kidney function, whether the diabetes was in control, making sure that the nerves to the feet were working properly, making sure that other illnesses like hypertension associated with diabetes weren't present, or if they were correctly managed. And we would take people through step up through various medicines, and we would use the most effective medicines, which funnily enough are actually the lowest cost medicines in managing diabetes. Now, the temptation is, we watch the television programs in the Cayman Islands, the adverts are there, go and ask your doctor about this, this, this and this. And it's not ask your doctor about the cheapest medicine, it's about the latest and greatest medicine as in the views of the pharmaceutical companies. But do people need those? And so there's two things here. One is the patient's feeling that they're not being looked after as well as could possibly, maybe because they're not being included or because they're having care which is disproportionate cost. And we're maybe not serving people as well as possible as doctors, nurses. I've got to blame somebody else as well. I can't be the only person, sure. We've got to take responsibility for affordable, accessible care. And that's one of the things that I'm very bothered about. It's something that's coming out already from things like the STEP survey. Some of our early feedback from people, again, can't afford it. Is the insurance enough? Is the insurance contribution divided in a way that it gives us the care that we need at the point we need it? A lot of these things are coming through. And I think that was a lovely piece that it hints, but please be even more explicit. Please tell us the whole story. Promise you, we won't do anything nasty. We will listen.
And by tying onto that, just because as you mentioned, I was at the seniors gathering for lunch, and actually there's two things that tie into that. One of the seniors mentioned, they go to their GP, and their GP has literally said to them, we have to see you within 20 minutes, and they're like, we don't even finish getting through our problems in 20 minutes. As he mentioned, not having enough time, and if we were to look at a flip side and try to look at a different way, like you said, where we may be dropping the ball, is maybe more time could be spent with a nurse or a nurse practitioner that did all of that right up beforehand, so that then they share the time between the doctor and the nurse, and then that would double the amount of time that they got to see a practitioner for to really address their needs. And then another one was also mentioning, the question was, why is health insurance for someone with diabetes more expensive than someone with high blood pressure? So you go back and you want to look at that insurance system and see what's going on there, and is it true that this is happening, or is it that because people are accessing these higher cost medications, it's driven up the cost of that particular plan?
Yeah, I mean, it's a really, really good point. And of course, the answer is the insurers need to make a profit. And so if they're taking somebody on with diseases which have got long-term multiple healthcare consequences, and again, I keep coming back to diabetes, it's not a touch of sugar. It is a significant illness, and uncared for, it will carry with it the risk of heart disease, kidney disease, loss of eyesight, everything else. So the insurers know this. They're saying to people, you've got to get treated and well treated, because otherwise we have to keep some extra money back for those long-term health consequences. But we, as the Ministry of Health and the government, ought to be recognising that there are maybe some double disadvantages that are going there. That we have got people that we are supposed to be looking after, that we are making an assumption that they've got insurance that will look after them, but the insurance might be so much more expensive because of those things. And so where do we fit in delivering the care for that particular element? So for instance, if we were providing the diabetic care, would there be an insurance differential with the insurers knowing that the long-term health consequences may be much less likely to occur?
Because it's managed.
Yeah, yeah.
And then if we take it one step further than that and we look at what is the ministry's role in regards to preventative care. So if we know that our islanders already, based on the STEPS program, have a high risk of obesity, have a high risk of diabetes and high blood pressure, what are we doing to properly educate the community about healthier living, making healthier steps? And then yet again, is that affordable? And how do we ensure that the affordable options, because of course, it's so much cheaper to go to a fast food restaurant than it is to go buy a salad, and looking at those things.
You get me on my other soapbox, of course, which is obesity. Just feeding it. I'll just say one thing to you, though. I'm asking the question about whether or not that fast food affordability is the big driver. I think there's an awful lot of habit and an element of addiction that's there. And that does mean that the kind of approach that we might want to take could be very, very different to we've been, in the past. I'm one of the worst offenders for standing up there and saying, obesity is your problem. It is. It's your problem if you are too big, because only you can change your habit. We can help and support, and we can care for, and we can look after. But there has to be a societal change. There has to be a change at the individual person's level. There has to be a change in families. There has to be a change in schools.
It's a multidisciplinary approach to change. It's not just one thing is going to fix it.
Yeah, it is. But I think we've got to get a little bit out of some of the mindset of excusing that change doesn't occur. I wasn't criticising, but you just gave me a lovely opportunity there to say, I keep hearing it's affordable, but can you afford the ill health? And that's the big point. What are you investing in?
But do they actually even see that correlation? You know what I mean?
Yeah.
That's the problem, is that you see it from an outsider, but when they see it and they think, okay, well, we're driving home with our family of 3 small kids, and it's 8 o'clock at night because they've had whatever, and they're trying to get something. They don't have something prepared at home. They want to feed them something, and in between their house and there is some place that they can afford to get them, let's just say, something, and they're fed. And then they don't see the negative knock-on effects that it has on their ability to concentrate at school, or their blood sugar levels, or their poor nutrition, and then what that looks like later on as they grow up. And then that habit forms of, like you said, the addiction of, we feed ourselves this because we enjoy it, because we like it, because we've done it for so long. And I don't know that people necessarily see the correlation.
It is. It is a lot of changes in lifestyle that need to occur. Sort of, people who know me and know me back in the UK think what a hypocrite, because I used to be 100 pounds heavier than I am now. So I was a big lad. And I know that getting rid of that weight, changing your lifestyle, everything else, and it isn't just eat healthy. There's a massive amount, to do to get there. But you can do it. People can do it. It's easiest to do as a whole community, as a family, as a whatever. That supportive nature. A lot of the most successful people, systems for losing weight actually are group support systems, where people encourage each other, care for each other, help each other through those problems, share advice and support about what worked for them, and so on. And there's a dearth of that kind of thing in the way that we organise healthcare systems. And so again, another thing that we need to be looking at and thinking about, but needing feedback from. Is that the kind of thing that you cannot source, where you're doing? And I do appreciate 3 children. Well, I only had 2. I think you had 1 or 2 more. 8 o'clock at night, I'm dog tired. Okay. That smart chief medical officer says, well, we'll tell you that he handled it by doing his batch cooking at the weekend, freezing stuff, having things ready and so on. That's being smart after the fact, and I just do not need that advice now because I've got 3 young children, I'm tired. I understand.
I think our community has suffered somewhat in terms of the lack of information and our own local data. So CMO would see this a lot in terms of referrals, so he knows some of the issues that we're having as a community from a health perspective, whereas the average person may not know that these things exist unless you're going through it yourself. So where we are now trying to get in terms of our next steps, with the STEP survey and that report coming out and highlighting what those issues are and what the proposed plans of actions are, will be really key in terms of how we change the narrative in our community. I really think sometimes there's that lack of not knowing what our numbers are, that really, if we did, we would probably make different decisions. So that's where the ministry is trying to get, in terms of having that data and using that then to drive then programs that are relevant for our persons to be able to access. And just to say, most persons will understand that that is a key priority for our minister, who has pushed that from her inception of her term in terms of being data driven, and so we embrace that wholly, and look forward to having our STEP survey results come out in a public format later on this year, so persons can better understand how we can make the changes that we need locally in healthcare.
Yes.
Okay, so it's just a comment, not quite a question, but it's eat less, exercise more, and spend time talking to people and family rather than texting them. It's good for the mind and soul.
Absolutely. I'm a complete Luddite when it comes to the texting things. I think a telephone's really useful, but to talk to people. But all the rest of the, I've seen people doing it with two thumbs. I can't do it. I've still got to poke once at a time. But yeah, I mean, it's a great summary. And actually, that talking to people speaks to all mental health welfare as well. It's about sharing problems. It's about getting support. It's about showing other people that you love and care for them. So maybe that is an area. I've not seen the research on that, but the technology, is technology getting in the way of us being communities?
Okay, we've got another one around the environment. So adding more shaded play areas for adults and children would encourage more fitness activities and save the nation so much in the long run.
Yeah.
We agree.
We agree.
Yeah. Absolutely. I mean, a colleague from the UK sent me this thing. In the UK, there's this, all primary school children run a mile with their teachers every morning. And he said it's great because they don't need to get changed into PE gear and so on, because it's the UK, it's cold, it's wet, it's miserable. So they don't need to get changed because they're not getting hot and sweaty and so on. And it's about the adaptiveness, but also I think something I was interested in as I've been, I go around the island, different places, different communities have different things that they enjoy doing. And it's very interesting to watch, for instance, how well used school sports facilities are by the local Caymanian population. And investing in that because you can put all those additionalities that make things comfortable for this environment. We often look at examples in other countries, but they don't have the same. What is it people like doing? Whether it's five-a-side football, whether it's dancing, whatever, it's doing the things that the community want to do, not what we tell them to do. We should only be listening and making sure those things the communities can use are available to them, in the places where they can access, and they're affordable.
Right.
And that's what we want to do, continuously, but really throughout the month of May, is really listen to people and get your feedback. So actually I think this particular one has come up more than once. So it's definitely something that we're looking at, and we have an engagement group. So we liaise with different ministries and departments and units. So it's not just the Ministry of Health and Wellness. We are working across government to look at these particular issues. Just going back to patient rights, so there's something here around, it's a comment. So they get offended when you ask for a second opinion from another doctor. Perhaps it goes back to that education and making sure that the public are aware of their rights and the fact that you should be able to ask for a second opinion.
Yes, and as a clinician, not only should you respect that, but also there are times when you should offer it unasked. Somebody has a complex disease, they have a disease that maybe is likely to have a very poor outcome, or you're being honest with yourself and think, I don't have the confidence of this patient, and say to them, I'm going to send you to another doctor because I think you need reassurance that this is the right thing to do. I don't get a great feeling, and it's not personal, I don't get a great feeling that you feel comfortable with my opinion, and I need you to be comfortable so that we can plan your care. And having a second opinion is not just right, but in many healthcare systems, it is a patient right. And maybe I wouldn't have thought that when I was an arrogant young doctor 40 years ago. Now I look at times where I think, you know, you wouldn't have made that mistake with that patient if you'd have just done that and had the sense to think, hey, get somebody else to look at them. Don't have the arrogance to hang on and say, I'm right or wrong. Just do it. But equally, as a patient, guide your doctor, guide your nurse, guide your midwife, guide your pharmacist, whoever, and say, you know, and I'm really keen on this. Everybody is a professional here, but guide them and say, you know, I'm sure you're right. You know, I do trust you. It's not a matter of that. It's just a nervousness on my part. This is so important. Please, can I speak to somebody else as well, so that I've got that reassurance and I can go into my treatment without worry.
And I mean, I'd also encourage people to continue to do it, because what we do see happening within the healthcare system is that quite often more and more of these hospitals are creating interdisciplinary teams like they should have. And in those, they may have the whole group consult on the cases externally. So there may be other involvement from other clinicians that are happening that the patient doesn't see, but because the patient doesn't see that, the assumption is it's one person's view on their treatment plan. So the same way they would liaise with their colleagues in regards to what their idea is for that plan, the plan of care, it's the same thing the patient is asking them for. So let me see someone else and see if they concur with that. And so that's what we do anyway. So we should be more open to sharing that and allowing people to do that. And I'd encourage people to keep asking, because it will give them that confidence that this is, you know, it's their life, it's their family life, their loved one's life, and they need to be sure, just like we do if we wanted to buy a house, you know what I mean? We get different quotes on what it could be because we want to buy the best for the best dollar. It's no different with our healthcare.
Yeah.
And could I just come back to something that just occurred to me, that it's so useful coming out of raising that question. It's not directly related to, you know, this health strategy, but CNO and myself are very interested in setting out what the professional standards are for clinicians in the Cayman Islands, and we're working up a draft of what should be in there. And we'll be asking clinicians and others what they think of our ideas of what standards they should be held to. But having the patient voice in there and having the public voice in there and saying, what do you expect of the people treating you, is something that we're looking for. And if people want to send those views in as part of this exercise, even though that wasn't maybe the main point, please do. That'd be great.
Thank you, CMO, for bringing that up, and CMO for leading that on, because that was right where my next comments were going to be made in that regard. As we have to find ways to empower our people to know their rights and to be able to ask for those, and like you say, get the best decisions that is pertinent to them. You are the person experiencing the issue. You best know what's happening with you, so you have to have that avenue to be able to get additional opinions where necessary.
And I just got to share, because it's part of my passion. For those of you who know, I've recently come from hospice and palliative care, and one of the stories I love to share is about a gentleman who had advanced pancreatic cancer, and he had problems with the lungs, so he had 2 chest tubes in him. And I remember sitting there when his oncology offered him more chemotherapy, and he said he wanted to go home, and I was kind of like, is that probably the best thing in that regards? And what I learned from that situation was, he looked at me and he could see that I was kind of like, couldn't understand his decision. And he says, when I used to sail back in the day, I would sail in races, and when I'm racing and I was coming in last place, I'd have 2 options. I can either choose to sail in and enjoy the sunset, or I could do one last wacky thing to try and win the race. He's like, I was the guy that wanted to do the last wacky thing to win the race, and that's how he lived his life. And I think as clinicians, we need to remember, you know, it's not about what we think is best for the person, but it's what they think and what they want based on who they are and what values and matters to them. And that's why people ask for second opinion, and that's why it's so important that we hear from you, because each one of you have a different path, and we want to include as much as we can in this health strategy, and also holding our clinicians accountable to the care that you want, because that's really when we're going to make the biggest difference.
Yes, totally agree.
Okay, so there is another, it's a comment. So absolutely not much mental health education, not enough youth counsellors, mental health professionals too much stigma around mental health issues?
Yep. I think there is a good kernel to that observation. I think we've got an awful lot of mental health practitioners. The question is, have we got the right ones in the right places? And particularly bearing in mind that mental health can often be a long-term problem, where people might need more help at one time, less help at other, and they will go through a pathway of needing different things at different times. And I'm a firm believer in giving that care in the community whenever possible, because normalisation, being in a community with family, with friends, undertaking your work as far as you can, undertaking the care of your children as far as you can, whatever, creates an environment that you recognise and are familiar with and gives you confidence. But also providing as much care as we can in the community is really important in that other point about stigma. And stigma is a thing that holds back mental health care. It holds back people seeking mental health care, and it holds back the way we deliver mental health care. And it's an extremely well-made point.
Yes.
And around the development of Ponciana, we are looking not to have just a place where care is given, but a focus from where care can be planned, where we can train people and where we can develop the community services so that we have people in their own homes, in their own communities as much as possible, with the right treatment that is available to them. Sometimes that's acute, sometimes it's not. But we have the full range and we can support people throughout their life with that mental illness. I think we need to be careful though about that we do this on an evidence-based basis. So for example, there are a lot of targeted mental health interventions which are very good. There's a lot of things that are covered under what people loosely talk about counselling, which are not, and can indeed exacerbate mental illnesses. So we've got to be really careful that we get the right things in the right place at the right time. Often, when people, for instance, we often hear about, oh, there's been a tragic incident, people will need counselling. We know that that actually usually makes a number of people a lot iller. But normalisation of the environment, so people are doing the things they were used to, and getting support from the people who know them best. And that's usually family and friends. Now if 4-6 weeks down the line, there's still an acute anxiety or depression state, that needs clinical management. But sometimes putting things in because we think we should be seen to do things, or we hear that that's what's done elsewhere, is not necessarily the right thing to do. So yes, I think whoever made that comment has made a really good point. The stigma point especially important, but also let's think about what evidence says to us is the best care given by the right people with the right skills at the right point in time.
And if I could tie on to that, some of that's also educating, I think. So yet again, if we go back to one of our goals within the Ministry of Health and Wellness is better health promotions in that regards. How can we assess, identify those who really need more care versus someone who just needs to have someone to talk to, have that family support, as Dr. Gent mentions. And that's one of the goals that we hope this strategy will also have a part of it is more promotion in regards to what is mental health, what does that look like, and the more that we can talk about it, we can help to decrease that stigma.
It's the old-fashioned idea of hygiene. It goes back 3,000, 4,000 years ago. I mean, this is about how is your life structured. We call it wellness and all kinds of things now, and and there's all kinds of fancy names. But things like, for instance, when we're talking about exercise, having a nice place to go to, which has got good cover and it's cool of an evening and things like that. That's not just about the physical
Yes.
But that's also about separating, you know, the work or the school day off to the relaxation, so that you've got the mental hygiene along with the physical hygiene. All these things come around again, even if they do take 3,000 years to come around. But yeah, it's really, really good point.
Yes. Yes.
And I just wanted to share with people, there is a number you can call that's not a crisis line, but it is a source of support for mental health. So it's 1-800-534-6463. And that is K-Mind. Okay, so we do have a comment relating to insurance. So please discuss the inadequacy of the SHIC plan, in that it doesn't even cover eye checks as a part of the plan.
Well, yeah. So we're chuckling, but it's only because we know that that's our next one right now that we're dealing with in terms of wholesale review of the Insurance Act. So some of this has been brought up to the Health Insurance Commission already in terms of the cover that's provided, the benefits that we have under the current SHIC plan. So that is in the works right now, and so we will be providing more on that, and obviously the public will have every opportunity again to engage in terms of changes that are being proposed to the Health Insurance Act shortly.
Yeah, I think I think those of us who've been looking at the Health Insurance Act, we've appreciated that what was put in place many, many years ago, which was essentially to fund and allow the supportive development of, I think, primarily hospital-based care and specialist-based care, has failed to keep up with what we would ordinarily call primary care in our little ivory tower, which of course is things like the services of GPs, pharmacists, community nurses, community psychiatric nurses, and you know, ophthalmologists, opticians, and the like. The everyday things, which are actually 90% of healthcare contacts in many healthcare systems, but we have an insurance system that quite probably mitigates against that happening. And that's an area which is ripe with opportunities for health promotion, health protection, and about building a future healthy lifestyle. So yeah, I think you can say that we've taken the message, but that doesn't mean don't tell us, because we still need that burden of, you know, 500 people, you know, reported a problem with their SHIC insurance not giving them an entitlement to this or that. 200 people said this or that. You know, we need that big burden, because quite reasonably we've got to go to policymakers and say we need some, you know, potentially some quite significant structural changes. And in doing that, they're quite rightly going to say, but you know, this is government money.
Show me the proof. Show me the proof.
Justify it. And so your voices are needed to justify that. Well, yes, we can get objective, you know, evidence from things like the STEP survey. That's going to be important. But the quality, the style, and everything else as to how things are, you know, delivered. And this important thing: what are the barriers? Great one. There is a barrier. My insurance policy does not let me do this. We need to have that chapter and verse, please, folks.
Just encouraging persons, if they do have those health insurance queries, to also reach out to the Department of Health Regulatory through Mr. Mervyn Conley, the Superintendent of Health Insurance, and they are very, very eager to help persons who have queries in terms of health insurance, that may be able to point people in, you know, another avenue, or to help them to understand what cover they do have, and to be able to help them to attain that.
I mean, because sometimes there's a bit of myth and legend here, and there might be an entitlement, but it's not understood, or how to get that entitlement, or other avenues to get help and support. So, yeah, do contact us. That's a really important point.
And I guess that goes back to the public education piece and making sure people are aware. of their entitlements and their rights.
Yes.
Okay, so there is another one around public transport. So start by improving public transport, cutting down the time spent in private vehicles, adding more bike lanes and shaded walking paths, and then it goes on to say lowering import duties on fruits and vegetables, which would allow more Caymanians and residents to keep a healthy lifestyle and fresh food lifestyle.
So somebody's ticking all the right
Yeah,
boxes.
very valid, very valid.
Can I just add one thing, though, to the public transport? Road safety.
Yeah.
It is a public health problem. We're currently running at a death rate of 12 to 15 deaths per 100,000 of the population per year. And the average speed limit here is 25 or 30 miles an hour. It's one of the lowest speed limits I've ever come across. And you go, say, to the UK, the death rate's 3, a quarter of this, and I'm conventionally driving there at 70 miles an hour. Europe, 4 or 5. You know, we've inherited a lot of bad habit. Forgive me, I know it may be the wrong, but selfishness in the way that we use the roads in Cayman. We're hurting ourselves, and we're hurting our friends, and we're hurting our colleagues. We should have less than a quarter of the number of deaths that we're having every year. And I'm not even talking about the number of people who are injured. You know, because similarly, we're probably having 3 or 4 times more injuries than we need. And we've really got to tackle that.
And we know there is a road safety council as well, so it will be really important to kind of connect with that, and absolutely that's a public health issue.
Yeah.
So thank you, Dr. Jem. I just wanted to share with people contact details for the Department of Health Regulatory Services. If you wanted to make contact with them, their phone number is 946 2084, and you can email them at hic@gov.ky. Okay, so we have around 5 minutes left. I just wanted to encourage everyone, please, to comment, ask questions. If you feel like you think of something after we finish up this afternoon, please email us at mohfeedback@gov.ky. Or you can call us, but please take our survey. So we have a public survey which is on our government website, on our webpage. If you scroll down to the bottom of the page, you'll see a link. You have until the 31st of May to complete that. So we would please encourage everyone to do so. Share it with your friends and family, because your voice matters, and we want everyone to have a say in the new National Health Strategy. So with that, just as we have 5 minutes left, I might just ask the panel to go around and just make some closing remarks, and then we will conclude. So Chief Officer Pucci.
Okay, so just to thank everyone again for the opportunity and for your feedback, which will be coming, I'm sure. We, as Lauren said, we want you to have your say. Your voice does matter. We do need to understand all of the issues. That helps us, as we said, to develop the correct policies and legislation that helps our people to be able to thrive. From a health perspective, it helps us to know what infrastructure we need in terms of healthcare, workforce planning, how do we look at students going off to do careers in healthcare, and what does that look like? What do we need to focus on? What are those key areas? Also in terms of, like we talked about, clinical standards for care, what quality of care, and so forth. It's very comprehensive, but very important. How do we look at financing the healthcare system that we have currently and into the future? What does that look like? What are those changes that we absolutely need to focus on currently? And then in terms of what the plan will look like after we've had the feedback and the analysis done on this national health strategy. So please do participate. It's very, very important. Your voice is critical to helping us to develop the change that we need and to ensure that we have a well-functioning healthcare system in the Cayman Islands.
all great points. I mean, I obviously have my own areas I'm really looking out for, and I hope what's come through strongly today is I'm really bothered about the people who cannot get care or are finding barriers to getting the care that they needed. I'm not looking at sort of that our island's full of lawyers and everybody else. I'm looking for everybody who lives here, who possibly lives in some more straitened circumstances, have problems being able to afford care, doesn't have healthcare need them, or is frightened of or approaching people to get healthcare because they're worried about the costs that it's going to occur to them. I want to know their stories. I want to know which are the illnesses or which are the disabilities or what are the mental health issues that are the ones where we are not doing the right thing for us as a Caymanian society.
Yeah, definitely ditto in that regards. But I mean, for me, I'm just super excited, absolutely excited, because as a young Caymanian, and yeah, I still see myself being young, we now have the opportunity to forge a pathway as to the difference we want to see in our Cayman Islands, and that is something that we didn't have an opportunity to or felt like we did in the past. And the ministry is standing behind you, saying, "Tell us what you want, so that we can fix it and make it better, so that we have the Cayman Islands and the health and wellness for the future."
Right, thank you. Thank you so much, everyone. And just thank you so much to our panel. So Chief Officer Nellie Pucci, Chief Medical Officer Dr. Nick Gent, and our Chief Nursing Officer Felicia McLean. I'm Lauren Stainton, Senior Policy Advisor in the Ministry of Health and Wellness. Thank you, everyone, for joining us today. We would really encourage you to please keep commenting, send us your questions, send us your feedback. You have until the 31st of May when our consultation closes. Wishing you the very best and have a great week. Thank you.